Under the reform we're proposing, if you like your doctor, you can keep your doctor. If you like your health care plan, you can keep your health care plan.
Did I say that? He must be thinking. Remember when the president said that? Well, in the midst of Obamacare rollout, thousands of doctors in Connecticut have been dropped from UnitedHealthCare's Medicare Advantage contracts. So is there a connection between the two? We're going to find out by asking Dr. Scott Gray. He's an orthopedic surgeon who just received a termination letter. Good morning, doctor. Thanks for being with us.
Good morning. Thank you for having me.
We have an excerpt from the letter that you received, so I'm going to read that here so our viewers can understand. It says, quote, "Given the significant changes and pressures in the healthcare environment, we have undertaken a review of our network and are making changes to its composition. As a result, UnitedHealthCare is amending your agreement referenced above to discontinue your participation in the Medicare Advantage network." They're not explaining the reason behind this termination. Did you contact them to find out why?
Yes, I did on behalf of my practice. The very next day I contacted them and I was told that it had nothing to do with quality or cost, but the reasons were proprietary and they weren't at liberty to discuss it with me.
Dr. Gray, in terms of what this means for patients, because what I'm hearing is at least 1,000 doctors in the state of Connecticut alone are in your very same situation. What does this mean for patients that were under your care?
It's a significant problem. In my practice, we have hundreds of patients that were given 2 weeks, that are basically have 2 weeks before open enrollment to try to find a new physician for services that either I provide or even their primary care physician. Most of them are completely unaware that this happened. I would say that since they're the most vulnerable portion of our population and their capacity to even understand and do anything about this is significantly limited, it really leaves them in the lurch. And if you can imagine patients who are very ill and under primary care, physician care, or maybe they have an oncologist and they're in the middle of their cancer treatment and all of a sudden they're going to lose their trusted treating physician or cancer doctor, we feel it's pretty horrible and puts these people in a terrible medical, ethical dilemma.
The group said that you could be discontinued due to cause, though we haven't been able to determine that, neither have you. So are you saying that the burden is going to fall on the backs of the elderly patients, those that are more extreme in terms of their health needs?
It does. If they have a physician that's taking care of their multiple problems, whether or not they're being taken care of in an efficient or quality capacity, they've been dropped. So the patients may not even find out that they've been dropped until they show up in the office. Some of our patients have told us that they received a letter just identifying that open enrollment is ready. And when they go onto the computer, those who have computer capacity and capability, they find that their physician, like our group and myself, is still on the computer. But when they call their broker might tell them we're not. So there's really huge confusion out there from a patient standpoint. And again, these are the people that are least capable of understanding this and even doing anything about it.
Dr. Scott Gray, we're certainly sorry to hear about your situation, the patients under you, but we want to thank you for bringing us the real-life situation that's going on as Obamacare rolls out. Thank you for being with us.
You're welcome. Thank you for having me.
You got it.